Hello, I'm Tony DeMaria, the editor of JACC, here to discuss a forthcoming issue of JACC, specifically our March 6th edition. And one of the articles in that issue that's really of interest deals with this exciting technique of renal sympathetic ablation in patients with resistant hypertension. And we know these patients are very difficult to deal with, and there's been some really encouraging study that renal sympathetic ablation can control the hypertension in these patients. And in this study, Dr. Brandt and Associates from Austria and Germany studied the effects of this renal sympathetic ablation on left ventricular size and function. And what they show is a 17% reduction in left ventricular mass. And this is accompanied by a reduction in diastolic dysfunction, specifically an improvement in diastolic function. And we know that left ventricular mass is even more important prognostic indicator in patients with hypertension than blood pressure itself. So some additional very encouraging data that this new technique of renal sympathetic ablation can be very effective in patients with at least resistant hypertension. A second article in that issue deals with the Watchman device for left atrial appendage occlusion in patients with atrial fibrillation. And we all know that there's lots of patients with atrial fibrillation who really aren't good candidates for anticoagulation, and where left atrial appendage occlusion could be a very attractive alternative. This specific sub-study of the PROTECT AF trial, which showed that the occlusion device was essentially non-inferior to standard warfarin therapy, this sub-study dealt specifically with those patients in whom occlusion of the left atrial appendage was incomplete. And this was a significant percentage of patients, some 25 to 30% of patients. And the question was, were these patients at risk to additional events? And the interesting data from the study are that, in fact, even in the presence of incomplete occlusion, the patients did quite well, did about as well as conventional warfarin therapy. Now, a big cautionary note to that is the fact that many of these patients were continued on warfarin, so that we will need more data, but the data that's available is quite encouraging. A final article, and not the least of the very interesting articles in that issue, deals with the histopathology of the left atrium, or specifically the pulmonary vein attachment, in patients who have undergone ablation therapy for atrial fibrillation and then subsequently have the arrhythmia occur. And a small group, 12 patients who had initially successful ablation and subsequently recurred, underwent a maze surgical procedure, and during that they obtained some histology. And what they found, interestingly enough, is that the cellular injury was either non-transmural, or there were gaps in the cellular injury in a high percentage of these patients. So whether or not the ablation was incomplete, or rather that there was some recovery, remains uncertain. But it does appear that this is a likely mechanism for the recurrence of atrial fibrillation in those patients who are initially successful. A very interesting issue, lots of additional good information in it as well. For Inside JACC, I'm Tony DeMaria.